Hi, I'm Jeanne Faulkner, and you're joining me today for my new video podcast series where we're going to be talking about women's health, maternal health, pregnancy, parenting, and whatever's on your mind. I've been a registered nurse for 25 years. I write Fit Pregnancies as the Labor Nurse column. I co-wrote the Complete Illustrated Birthing Companion, and I've been writing about global maternal health issues for years. I'm currently working on my next book, Brass Tacks Pregnancy. Since I've been answering women's health questions online, in person, and in print for decades, I decided that now is the time to open up the conversation a little bit wider. That's why I've decided to start this weekly video and podcast series as conversation starters to help women understand and talk about their health, healthcare, and our place in the world of women. We need to talk about this because the world's not doing a very good job taking care of women and mothers. Too many women are struggling to get the reproductive health care they need. Too many women get sick and die during pregnancy and childbirth, or they have lousy experiences that leave them traumatized and confused. And here in the U.S., far too many women end up having C-sections they probably don't really need. Some of the issues women are facing have to do with what should be basic rights by now, like the right to get affordable birth control, or to choose when or whether to become mothers, or the right to have maternal health care that's more about patients than it is about insurance, malpractice, and hospital policies that aren't always in women's best interest. Women have so many roles to fill these days, especially once they become mothers, and in many parts of the world, certainly here in the U.S., they're not getting the support they need to succeed. In many parts of the world, they don't even get enough support to survive. So that's what this revolution is about. It's about creating a culture that truly values women, mothers, and their health, happiness, and ability to live their best lives possible. But it's going to take a lot of change to make that happen. And my goal is to start with women's reproductive health and maternal health, and then move on to other vital issues that women are concerned about and dealing with. So why start with reproductive health? Because I think women's lives, especially once you become a mother, really boils down to whether or not we're healthy and thriving. Because even though many women in the U.S. receive really excellent reproductive and prenatal health care, many don't. Many doctors work under such ridiculous pressures. They're practicing medicine in ways that don't align with their values and the reasons why they went into medicine in the first place. Women don't always understand what's going on with their bodies, and they end up handing their healthcare decisions over to their stressed out doctors. Really, it's time that women knew exactly what they were doing and what they need to do to achieve their best health and health care. And it's time we let doctors practice medicine the way that they always intended to. So I'm not going to say that women's health care in the U.S. totally sucks. We have one of the most advanced healthcare systems in the world. We spend more money on health care than all other developing countries put together. Unlike women in many parts of the world, most American women can access some sort of health care, and most mothers have a midwife or a doctor with them when they give birth. And yet, with all that, we rank 50th in the world in terms of maternal health and mortality statistics. Approximately half of all pregnancies are unintended. Here in the U.S., approximately 800 women die during pregnancy and childbirth every year, and that number has multiplied in the last couple of decades. In fact, more women die or are seriously injured during pregnancy and birth today than in 1970. And we're filling up nurseries and neonatal intensive care units faster than ever and with sicker babies. I was talking to a young woman recently about how the U.S. stacks up in the annual State of the World's Mothers Report. This is a report that ranks women's status and well-being by country based on issues like quality and affordability of childcare, paid maternity leave, women's representation in government, women's education levels, and ability to achieve professional goals. The U.S. comes in at number 30, and this young woman was shocked. She wasn't shocked that women don't get cut any slack here in America. She was shocked because it never occurred to her that women are treated far better in 29 other countries. And it never occurred to her that she should be expecting more. The U.S. is one of only 4 countries that don't provide at least some level of paid maternity leave. Women have less than 20% representation in government. American women make up nearly 2/3 of minimum wage workers, and the majority receive no paid sick days. A third of American women live near the brink of poverty, even though women earn most of the college and advanced degrees, make most of the consumer spending decisions, and make up more than half of the nation's voters. I know we can do better, but seriously, it's going to take all of us. It's going to take education, communication, a demand for higher standards, and political strength. It's going to mean that every woman has to stand up and ask for more, give her all, and demand to be treated with the respect and support she deserves. That's what we need to talk about. We need to do a better job supporting women to be the best they can be, whether that's as working moms or stay-at-home moms, single moms, teen moms, or not moms at all. That's why I'm starting this series of weekly video and podcasts to talk about what it means for women and mothers to be healthy and about our place in the world of women. Watch for a new video and podcast every week, and let's get people talking. Thanks for being here with me.